Did you know that dizziness can be caused by something as simple as a medication? In this video, I'm going to show you the 10 most common medications that could be making you feel dizzy. 1. Antidepressants, e.g., fluoxetine, sertraline. Antidepressants like fluoxetine and sertraline are often prescribed to manage conditions like depression and anxiety. While they can be effective in improving mood, one of the side effects is dizziness. These medications work by altering the balance of neurotransmitters in the brain, which can disrupt the body's equilibrium. For some people, especially when they start taking them or increase their dosage, dizziness can occur. It's important to be mindful of how your body reacts to these meds. If you start feeling dizzy or lightheaded, it's worth discussing with your doctor. Adjusting the dosage or changing medications could help manage this side effect. 2. Blood pressure medications, e.g., losartan, enalapril. Medications for hypertension, like losartan and enalapril, are essential for controlling high blood pressure, but they often come with the side effect of dizziness. These medications lower your blood pressure by relaxing blood vessels, which can sometimes cause a drop in blood pressure that leads to feelings of lightheadedness. The dizziness is particularly noticeable when you stand up quickly from sitting or lying down, a condition known as orthostatic hypotension. If you experience dizziness after taking these meds, it's important to avoid sudden movements and consult your healthcare provider, as your dosage might need to be adjusted. 3. Anxiolytics, e.g., diazepam, lorazepam. Anxiolytics such as diazepam, Valium, and lorazepam, Ativan, are commonly prescribed for managing anxiety disorders and panic attacks. These medications work by calming the central nervous system, but their sedative effects can cause dizziness. While they are effective in reducing anxiety, they can make you feel drowsy, and for some people, they can cause a sense of vertigo or lightheadedness, especially in the initial stages of treatment or if the dosage is too high. If you're taking anxiolytics and experience dizziness, it's important to talk to your doctor about possible alternatives or dosage adjustments. 4. Antihistamines, e.g., Dimetapp, Betadine. Antihistamines are widely used to treat allergies, colds, or flu symptoms, with medications like Dimetapp and Betadine being common over-the-counter options. However, older or first-generation antihistamines can cause drowsiness and dizziness due to their sedative effects. They work by blocking histamines, which can affect the brain and balance, leading to that spinning feeling. This side effect is particularly noticeable when you first start taking them or if you take a higher dose. If you experience dizziness from allergy medications, consider switching to second-generation antihistamines, which are less likely to cause sedation or dizziness. 5. Sedatives, e.g., zolpidem, alprazolam. Sedatives like zolpidem, Ambien, and alprazolam are frequently prescribed for conditions like insomnia and anxiety, but they can also lead to dizziness. These medications work by depressing the central nervous system, which helps induce sleep, but they can also cause coordination problems and dizziness, especially in the morning after waking up. The feeling of dizziness or grogginess may linger into the next day, affecting your ability to perform daily tasks. If you feel dizzy after taking sedatives, make sure you get plenty of rest, and talk to your doctor if the side effects are persistent. 6. Diuretics, e.g., furosemide, hydrochlorothiazide. Diuretics are medications used to treat conditions like high blood pressure and fluid retention. They help eliminate excess water and salt from the body, but in doing so, they can also cause dehydration and an imbalance in electrolytes such as potassium and sodium. This can lead to dizziness, especially if you stand up too quickly or experience low blood pressure. If you're taking diuretics, it's essential to stay hydrated and monitor your electrolytes regularly. If dizziness persists, your doctor may adjust your dosage or recommend a different diuretic that's less likely to cause these issues. 7. Diabetes medications, e.g., metformin. Metformin is one of the most commonly prescribed medications for type 2 diabetes, helping to control blood sugar levels. While it's effective for managing diabetes, it can cause dizziness if blood sugar levels drop too low. This condition, known as hypoglycemia, can occur if you miss meals, exercise too much, or take too much insulin in addition to your metformin. Symptoms of hypoglycemia include dizziness, sweating, and confusion. It's important to regularly check your blood sugar levels and maintain a balanced diet to avoid these episodes. If dizziness becomes frequent, it's important to discuss your treatment plan with your healthcare provider. 8. Migraine medications, e.g., topiramate. Topiramate is a medication often prescribed to prevent migraines, but it can cause dizziness as a side effect. It works by altering the brain's nerve signals to prevent migraine headaches, but some people experience dizziness or balance problems, especially when they first start taking it or when the dose is increased. If you're using topiramate for migraine prevention and notice that you're feeling dizzy or lightheaded, it's important to monitor your symptoms and report them to your doctor. A dose adjustment may help alleviate this side effect. 9. Parkinson's disease medications, e.g., levodopa. Levodopa is a key medication used in the treatment of Parkinson's disease, and it works by replenishing the brain's dopamine levels to help with motor symptoms like tremors and stiffness. However, levodopa can cause dizziness, particularly in older patients or those taking other medications. The dizziness is often linked to a drop in blood pressure or the drug's effect on the central nervous system. If you experience dizziness while taking Parkinson's medication, it's essential to talk to your healthcare provider, as adjustments to your dosage or additional treatments might be needed. 10. Anti-inflammatories, e.g., ibuprofen, diclofenac. Nonsteroidal anti-inflammatory drugs, NSAIDs like ibuprofen and diclofenac, are commonly used to relieve pain and inflammation, but they can also cause dizziness in some people. These medications work by reducing inflammation and blocking certain enzymes, but they can also affect the inner ear and the vestibular system, which is responsible for maintaining balance. If you experience dizziness while taking anti-inflammatory medications, it could be due to a sensitivity to the medication or dehydration, which is common with prolonged use. Be mindful of your dose and duration of use, and consult your doctor if dizziness persists. If you found this video helpful, give it a like, share it with someone who could benefit, and subscribe for more health tips. See you in the next video.